Hi, my name is LaDonna Henderson. I'm going to be giving a presentation on creative implementation of leadership. I want to first take a look at my personality. I took a Myers-Briggs personality test, and I came up as an ISFJ. That stands for Introvert, Sensing, Feeling, and Judging. ISFJs are very industrious caretakers, loyal to tradition, practical, compassionate, caring. They're very grounded individuals, committed workers, and have a deep sense of responsibility to others. They focus on fulfilling their duties, particularly when they're taking care of the needs of other people. They want others to know that they are reliable and that they can be trusted to do what's expected of them. They are very persistent and work until the job is done. ISFJs are driven by their personal values. They typically want to work hard, get along with others, and make sure they do what's expected of them. They value relationships highly and strive to cooperate and maintain harmony with others. They want stability and longevity in their relationships. They appreciate tradition and they like knowing how things were done in the past. Very loyal, and they want to contribute what they can to maintain strong, stable social structures. Above all, though, ISFJs are characterized by their desire to serve others, their need to be needed. As a leader, I want to look at some of the strengths and weaknesses that someone with my personality would have, and I identify with these. Some of the strengths are, again, valuing tradition and routine, very organized, practical skills, able to promote a sense of belonging in other people, a great listener, strive for win-win situations. Love those win-win situations. Good at observing others' emotional states and seeing things from other people's perspective. And again, extremely loyal and hardworking. However, there are some weaknesses. One of them being difficult time adapting to change. And sometimes being a little bit too altruistic. Failing to recognize your own needs because you're too preoccupied helping others. This sometimes allows them to become overcome with too many responsibilities. And they take things a little too personally. One of the biggest weaknesses that I see in myself is that I dislike criticism and conflict. And it's one of the things as a leader that I would have to be careful of, because there's going to be conflict and there will be times when I need to critique others. Sometimes, as a leader, ISFJs have difficulty taking credit for their successes and for the things that they do, because they're always looking for that little minor thing that they feel like they could have done better, and it makes it hard to take credit for what they did right. ISFJ is a protector, one of the guardian temperaments. Kersey describes a temperament as an interaction between two basic dimensions. Basically, what you say and what you do. And those are the percentages of my introvert, sensing, feeling, judging. Effective leadership. Leadership is not a position. It's not a title. It's an action and an example. I don't actually have an official leadership position or title where I work now, but I do feel like I'm a leader, and I lead in my actions and my examples. So I work for Shady Grove Medical Center. It's located in Rockville, and it's a community hospital, 305 licensed acute care beds. We have a birth center, an emergency department, but in particular a pediatric emergency department. We are accredited as a Cycle 2 chest pain center. We have the cancer care, which is my part of the hospital, and surgical services, the joint replacement center, and the sexual abuse and assault center, which we have some specially trained forensic nurses that work in that center. So the cancer services is what I'm a part of at the hospital. And it's one of only 1,400 oncology programs in the U.S. that's been approved as a community hospital comprehensive cancer program. And the reason is because we offer both outpatient and inpatient services. Outpatient, we have our Aquilino Cancer Center, the Radiation Oncology Center, and the Breast Center. Inpatient services, that's where I am. We have a dedicated oncology inpatient unit. And we do all those things listed there. One of the big things we do, a couple of them, blood transfusions we do a lot of, and we do a lot of pain management. A couple of months ago, we were able to have a palliative care doctor come on board, and she has been an amazing benefit for our patients and for the staff as well. She's done a lot of education and helping us to understand more about end-of-life issues. Some of the legal and ethical considerations really for any nursing department: patient rights and safety, informed consent, advance directives, and particularly in this part of the country, interpreter services. As nurses, we are governed by the Board of Nursing, which provides laws that control how we practice nursing in Maryland. Now, in the cancer center, inpatient or outpatient, one of the main considerations that we have would fall under advance directives. It's important to note if your patient is a DNR or a full code. And since a lot of our patients are at end of life, you have to really pay attention to that. Sometimes families want one thing, patients want another. So you have to be careful to know what it is that your patient wants. And as long as they're able to make those decisions themselves, that's what you go by. Sometimes that creates conflict, and we even have to send things to the ethics committee when there's such discord in the family, not able to really accept where the patient's at and what it is that they want. On our unit, there are a couple of things that we use to promote teamwork. One is shared governance, and the other is relationship-based care. Shared governance basically means that nurses are the ones who are best qualified to determine what nursing practices work, what they are, what can be done, what can't be done. And it's important that nurses sit on councils and committees where those decisions are being made so we can provide input into those. Relationship-based care basically focuses on the relationships between staff and patients. And when you work on those relationships, the end result of that is that patients and their families feel safe and they feel cared for. A strong unit that focuses on the relationships amongst the staff members provides a positive environment. Cultural development for our facility is governed by our mission, and our mission is to demonstrate God's care by improving the health of people and communities through a ministry of physical, mental, and spiritual healing. This mission guides what we do. Our culture is important because it unifies us as individuals and it gives us a common goal to work toward. We're all working for the same thing. Now we'll look at leadership style. My leadership style, well, first I want to say a good leader leads the people from above them, but a great leader leads the people from within them. And as a leader, this is really how I function. I function best when I am a part of the group I'm leading. Not above them, but a part of them. And so my leadership style is basically a combination of shared leadership and servant leadership. And those two things really fit well with my personality. As a servant leader, I can utilize my natural inclination to need to be needed. And being service-oriented is a key component of my personality. And it serves me well as I lead from within, focusing on relationships and the dialogues between myself and my fellow workers. Some forecasts for my facility. We're expecting a Joint Commission survey this year, so we're preparing for that. We're also expanding the hospital. The emergency department and surgical services will get renovations and expansion. And we're also having a new branding initiative where we're getting new signage around the hospital, a new logo. Another way that we are forecasted for the future is to continue to evaluate where our employee salaries are and make sure that they're competitive in the marketplace. And we just recently opened up a new center care in Germantown. It's the second one. And these urgent care centers are important because they offer an alternative to coming to the emergency department for non-life-threatening medical care. Our accreditation is through the Joint Commission. We're also recognized as a top performer on quality key measures. And again, our oncology program is approved as a comprehensive cancer center. Return on investment. Our target audience are the people around our community hospital, the men, women, and children of Upper Montgomery County. And we strive to provide quality medical care to those who live and work in our area. Two ways that we seek to retain and motivate our employees are the Purple Star Awards and the Exemplary Leadership Awards. And both of these just recognize staff who go above and beyond and provide exceptional service and leadership and compassionate care for our patients. Human resources, we have employee benefits, an employee giving campaign, and our occupational health, which promotes safety in the workplace. As far as accountability, this is just a small section of the accountability chart for my facility. As a registered nurse, I answer to the assistant nurse manager, then to the nurse manager, then to the director of med-surg, and ultimately to the chief nursing officer. And below me, you'll see certified nursing assistants. I'm responsible for them and responsible to work together as a team with them. We also have a unit support staff and volunteers. So future planning. Looking at disaster preparedness, basically in this area you're looking at the weather. You can see a picture of the snowstorm. We had a huge snowstorm this past year. I ended up staying at the hospital Friday, Saturday, Sunday and sleeping there. So that was interesting. But our hospital is prepared to meet those needs as they come up. We have a mass casualty plan, a code yellow plan that we implement whenever the need arises. Succession planning and looking ahead at things. We have a nurse residency program for new grads. After that first year of being a nurse, we can enter into a mentoring program. And then we begin a professional career advancement program. It's a career ladder that allows you to advance in your career. And when you've advanced and you're finished with your career, we also have a retirement program. And the last thing I want to look at is networking. We have a Center for Health Equity and Wellness and a Community Health and Outreach. And these allow us to be really involved in our community. We offer classes on diabetes management, smoking cessation, and we also offer health risk assessments for diabetes, breast cancer, and colorectal cancer. So these are ways that we give back to our community. And lastly, our presence on social media. These days, you have to be on social media. That's where people are going to look for you. So we stay connected via our website, Facebook, Twitter, LinkedIn, Foursquare, and YouTube. Thanks for listening. This is my presentation on creative implementation of leadership.